Hello, everyone, and welcome to this audio podcast. This audio podcast series. This new sort of audio this sort of audio podcast series as part of the an audio podcast series in around the segmental scruples. The audio podcast in around the Rampage Sonar, and this audio podcast as part of the Blitz Lobostics, a Blitz Lobostics. So in this audio podcast, a little bit of an intro uh, to um, to some works, to a little bit of an intro in around works surrounding the need to consider sort of renal health or sort of nephrology in around sort of transfusion sort of practices and in around transfusion practices. Uh, and so transfusion practices are developing and are developing or have been advancing, incorporating many sort of novel sort of pharmacological agents into care in view of potential longer term in view of sort of the potential long term risks and the side effects of red cell blood transfusions. And there is ever more need to consider, however, the renal health in recipients who require transfusion care, especially since renal function is important in the synthesis of the hormone erythropoietin or EPO, erythropoietin, and where renal insufficiency where renal insufficiency is evident, this can be a difference, or there can be a difference between sort of morbidity and mortality. And although the risks are well reported, have led to the reevaluation of the criteria for the use of red cell blood products or red cell products, a significant sort of a significant evidence or evidences and sort of sort of proportion of transfusion practitioners, um, or a significant number of transfusion practitioners in their own right have not modified approaches because of the fear of the anxieties anxieties of or the, sort of the challenges, or sort of challenges, if you like, around the around sort of the mortality and morbidity relating primarily to low hemoglobin or anemia, and especially in those who can be who can who the especially in those amongst those who are in a or can be categorized as sort of untransfusible patients or recipients, and or patients at risk of sort of developing and at risk of developing forthcoming sort of complexities or complications. So that draws this audio sort of intro, this intro as part of this audio podcast to a close. This audio podcast as part of the segmental scruples, a segmental scruples edition or series. This audio podcast as part of the Rampage Sonar, and this audio podcast as part of the Blitz, Lobostics, and this audio podcast as part of a Storm Robotics production.